Welcome to Healthcare Matters Startup Edition. Did you know that in 2019, 1.27 million people died from drug-resistant bacterial infections as per a Lancet study? If we don't act, experts predict that by 2050, 10 million people could die from these infections. Shocking, isn't it? That's why I'm very excited to welcome the first guest of the Startup Edition, Dr. Nataliya Konova, the co-founder of AMIRA Medtech. Her startup is working hard to fight this challenge.
Hi.
Welcome, Natalia.
Thank you so much for having me. It's a pleasure to see you every time.
Thank you. Thank you for joining us today. Please have a seat.
Thank you. So how are you today?
I'm good. I'm feeling great having you and look forward to our discussion.
Okay.
And I would love to start, if you please share more about you.
Of course.
Not only the co-founder, but really about you as a person and as a leader.
Okay, I will start by saying that I'm a third generation doctor, which is something I'm very proud of. My parents, my grandmother, my aunt, all fabulous doctors. And I feel like medicine runs through my veins since I was little. And they managed to install curiosity and the desire to help people straight into my DNA. My parents are also entrepreneurs, or as they used to be called back then, businessmen, because entrepreneurs is a new word. And I think this, seeing their example, being entrepreneurs, really added an interesting twist to my destiny so far. Throughout my medical studies, I always looked what's behind the corner, What else is out there besides medicine and medical studies? What other skills can I acquire being a medical student? I started my first business when I was in first year of medical school.
Wow.
Yeah, it was an online shop for candles. It did not succeed. Then I opened a small coffee shop actually in Sofia, which worked pretty good for a year. And then I sold it with profit, which for me was a great success back then. And when I was reaching the end of my studies, my colleagues started working as nurses or started volunteering in hospitals. Something kept pulling me towards the corporate world. I don't know why. I got a job as a product manager in a Bulgarian pharmaceutical company. Then after that I got a job in a Swiss pharmaceutical company where I built a medical team from scratch. And I managed to see all the puzzle pieces of a big corporation, from R&D to manufacturing, logistics, marketing, sales, finance, everything that a company needs to work properly. And all of this experience for a young, curious person, I think, can open their horizons a lot. This is exactly what happened to me. Then I got enrolled in a course by accident by the Digital Healthcare Innovation Cluster, which was organized in our medical university. And in this course, I heard the word entrepreneur for the first time in my life. I did not know what this is. And it blew my mind because it felt like it resonated with me so much. In this course, I met Milena Stojcheva, the former Minister of Innovation and Growth of Bulgaria. And I look up to her so much. She inspires me so much. And she helped me get into Junior Achievement, which is a phenomenal organization. I was a PhD student back then. I still am, but I was just in the beginning of my PhD thesis. It's related to antibiotics.
Okay.
And I really wanted to create something practical for doctors. I didn't want my thesis to be sitting somewhere on a shelf and collecting dust. I wanted to actually create something that is used in hospitals. And the pre-accelerator Beyond helped do this exactly. This is where I found my co-founder, my colleague Theodore Stamenov. He is a software engineer, so we really bonded very well with different skill sets. We validated our theories, so they helped us talk to clients, how to make a business plan, how to find investors. So by luck, I think all of those steps led me to be here to talk about this journey. So I'm a lot of things. I'm a doctor, I'm an entrepreneur, and I'm passionate to keep seeing what's out there for me.
Thank you, Natalia. It's great to have you, and I look forward to our discussion.
Thank you.
Natalia, I'm curious to know more about your journey and what inspired you to start AMIRA Medtech.
So I am a PhD student in the field of clinical pharmacology. It's a specialty that tries to improve how medicines are used on a society level. And my PhD is closely related to antibiotic usage in hospitals. And when I was researching the problem with antimicrobial resistance and how antibiotics are used improperly in many scenarios in hospitals, I got inspired to do something about it. I got really scared about the prognosis of antimicrobial resistance, and I saw that using digital healthcare solutions, we can actually impact a lot this problem. So I had the idea, but I had no idea how to create it into something working. That's why institutions and organizations like pre-accelerators are extremely important for young entrepreneurs, because when you go in there, you get guided what you need to do, how to improve your idea, how to validate your idea, how to pitch your idea. And that's exactly what happened. I met my co-founder, and together we worked for 8 months to actually create something that is now working. We understood how to pitch our idea to clients. We understood how to talk to investors. So basically we refined an idea into a product. Our mindset changed a lot. We understood that we need to be more brave and to believe that we can actually create this impact, that we need to reach out to people who are in high positions, and that they're just people that will encourage us and help us if they see potential in us. So we needed to grow as people. We needed to become better at finances, at marketing, and human resources, even when you start acquiring people to work for you. So it's when your company grows, you grow with it as a person.
Exactly. And what is the specific health challenge that AMIRA startup is solving for?
So antimicrobial resistance is a global rising threat, projected to kill 10 million people every year from 2050 onward. I'm scared that this prognosis will happen sooner. I'll tell you later why. The global consumption of antibiotics is projected to drastically increase. With the increase of duration of life, people live longer, more antibiotics will be used, because the older you get, the more prone you are to get an infection. The problem is, no new antibiotic groups are being discovered currently. After the explosion of discovery of antibiotics in the previous century, now we lack antibiotics in the pipelines of pharmaceutical companies. And this is a big problem, because our children and our grandchildren probably will not have effective antibiotics to tackle infections. Now we decided to focus on hospitals. Even though a smaller percentage of antibiotics are used in hospitals, around 20%, the rest are used in primary care, hospitals are places where the most resistant bacteria emerge, and the most potent and reserved antibiotics are being used. And if those high resistance bacteria are not contained and they're spread into society, it will be a big problem. Something practitioners don't understand, medical practitioners, is that If a hospital has a very high antimicrobial resistant rates, it can and it should be shut down because it becomes a public hazard. Imagine a big hospital being shut down because of antimicrobial resistance. This would be a huge strain on the national healthcare system. Also, the costs of treating hospital-acquired infections are usually not covered by the national healthcare systems or the insurance companies, so it's a huge economical and financial burden, and it's yet to become an even bigger one. So yes, antimicrobial resistance is a natural occurring event that happens due to genetic changes in the pathogens, but our behavior as doctors, as practitioners, as patients many times, can seriously escalate and quicken up the spread and the rise of antimicrobial resistance. So this is the problem we're tackling, and our focus is improving how antibiotics are used in hospital settings.
And you mentioned that antimicrobial resistance is really a growing global health threat. What's your perspective on that as a physician?
I told you the prognosis. When I started working on this project, I was not yet practicing medicine. Right now I'm blessed to be able to practice medicine. And even though I work in an endocrinology department where infectious diseases is not our focus, almost every week we have a patient that comes either from another department or another hospital that now is a carrier and infected with a multi-drug resistant pathogen. And yes, usually those are immunocompromised patients, elderly patients, patients with comorbidities, and we somehow manage to contain this infection and treat it only with the superpowers of the microbiological departments. Those doctors, the microbiologists, are the superheroes in this war against antimicrobial resistance. The combinations that they make with antibiotics is the only thing that is currently saving those patients. And I'm really terrified what will happen when we cannot contain those infections. If we cannot cure these patients. Right now we're still at the border where we're able to contain it, but me working in this issue separately with our startup, I'm really terrified. But the human nature, doctors usually have very intensive daily routines, very heavy workload. They keep putting fires everywhere, and it's sometimes hard to think what will happen in 5 years, what will happen in 10 years, to have this projection. We have this Bulgarian saying, you don't act until the knife reaches the bone. I don't know if you understand it.
Yes.
And the knife is getting really close to the bone, and I think more and more people and doctors and patients are understanding this. That's why we try to speak about this, to bring awareness, to work with institutions, so that what I see every day in my practice can be stopped, contained, and measures can be taken. I don't know if you know, but the World Health Organization required every country to have a national plan to fight antimicrobial resistance. Fortunately, our country is yet to accept and implement this. We need to focus on not only human medicine, but animal medicine, agriculture. So complex measures are taken, and now being part of medicine as a practicing doctor and a startup entrepreneur person that works in this area, I see the issue from several perspectives, and I think more and more measures need to be taken, and that's why we're here to talk about this problem also.
Great, thanks for sharing. And now I'm curious to know, which was your proudest moments, during this journey with your startup, from development to validation?
Yeah.
Would you tell us about that?
It was a roller coaster, all of this journey in the past 2 years. We had amazing moments that made us so proud. First of all, when somebody that you are inspired from, somebody that you look up to, when they tell you, "Here you have an amazing idea, keep doing this, you're doing a great job," as a beginner entrepreneur, that's amazing. Then we started achieving awards after awards. We were selected Project of the Year of the American Chamber for Commerce, AmCham. We were selected by Forbes. We won several Intel AI and machine learning potential awards. And when you're just a young person that this passionate about your project and you start receiving these prizes and validation and encouragement, that is amazing. But I have to say, probably the proudest moment is when our first client signed with us. You know, to have a hospital or a client, doesn't matter what business you are in, to believe in you, to trust you, to give you this encouragement and push. You can do this, come on, we'll help you, we'll be your partner, let's do this together. You feel very, very proud. So I would say signing our first client was a very proud moment for us.
Congratulations, indeed, it's a very special moment.
Yeah.
And now going to my next question, and I would be curious to know what would be your advice to other women who are considering to start their own company or startup in healthcare?
I keep telling people around me, especially females, that now is an amazing time to be an entrepreneur, especially if you're a woman. So many organizations are supporting women currently to enter the entrepreneurship world, either with trainings or grants. So I feel like this is an amazing time to explore your skills, to explore your opportunities. So I keep encouraging everybody basically that I meet that is interested in entrepreneurship. I was an assistant professor. I spoke to a lot of students when I was teaching. So I spoke about entrepreneurship and they were like me before. They didn't know what this is, that you can actually be an entrepreneur. You know, that you can be a doctor, for example, or a lawyer and still be an entrepreneur, that this is a new option for you, a new pathway has opened in the past few years. And I feel like we're very lucky to live in this era of opportunities. So I do my best to encourage everybody that I find that wants to be encouraged to pursue this path, because it's amazing.
A very good reflection, and I hope we have more female leaders and they are empowered and come with great solutions to our healthcare challenges. Yeah. Would you like to ask me anything?
Yes, I have a question for you as well. You and your company, you're very passionate to be involved in projects that nurture young entrepreneurs. Not a lot of companies understand the value of this path. Can you tell me why do you do this? What purpose do you see in this? Because it's very curious to me.
This is very true, and thanks for asking the question. I actually have two reflections about that. The first one, that our Roche believe that 99% of innovation and solutions to our healthcare challenges are out there with really young talents, with young leaders, different mindsets, with the startups. So we have this strong belief that it needs a lot of collaboration and acting together and acting now. And we are always kind of impressed with the quality of the solutions, with the creativity, with the innovation, with the proactive problem-solving approach. So this is really belief, and we try always to act on it. And the second angle that we believe also it's part of our giving back to the community and the society, either locally here in Bulgaria or on European level, on a global level. For example, here locally we had a great partnership with Junior Achievements, where we had a lot of interactions with brilliant minds, a lot of great young leaders. And we believe that the future of our healthcare is in the hand of those great talents.
That's amazing, and I'm very happy that you do this, because me myself, I was directly impacted by your support. So a big thank you for doing this and for understanding how valuable this is. And I think it's a win-win, both for entrepreneurs and both for companies like you who do this. So big thank you, and keep doing what you're doing, because the world needs you.
Thank you. It's our responsibility and it's our pleasure. And as you said, this is a win-win, and you get together the best of two worlds, and you build bridges between two great, worlds for the better of our patients and healthcare system.
Yeah, amazing.
Natalia, now we are coming to the end of our episode today of Healthcare Matters. Would you like to share any final reflections?
I would just like to thank you very much for having me, for supporting us young entrepreneurs throughout our journey, and for allowing us to have the voice and the stage to state what really matters to us and the causes that we're fighting for. So thank you very much.
Thanks to you for the insightful discussion today. Thanks also for sharing the inspiring example. It's really inspiring to see such successful leaders tackling such a challenge. And we believe that our healthcare system needs a lot of successful leaders like you, because healthcare matters.
Yes, absolutely, it does. Thank you so much.
Thank you, Natalia.